So, hello. Yes, Susuku, Nimisha, Elizabeth. We have two more students remaining. Yeah, they got this portion already. Yes. So, today we are going to talk about pre and post operative care. Okay, most of the questions of fundamentals of nursing comes from this chapter. Okay, and we have studied it in various chapters, but this one we will give special attention to this chapter because so many questions we will be able to answer in fundamentals of nursing. So, Nimisha, can you tell me why we need a pre-operative preparation? Can you unmute and tell me?
To find out the patient is sick for the surgery and if there are any complications is present or not.
To relieve anxiety.
There are so many risk factors related to surgery and they need to clarify the queries regarding the surgery.
Okay, very good. Very good, Nimisha. Yeah. So number one is that most of the patients will be anxious about that. Yeah, a lot of psychological support, family preparation. Not only patients, family also should be prepared to relieve anxiety. Then you see why we are giving pre-medication is to decrease the secretions. Okay. Then another thing is that you see if you know the complications already, pre-operatively if you give them good teaching, they will be able to cope up with the post-operative days. Okay. And important thing to remember is that patient should be in optimum health. If patient has some disease condition, that is why we are doing surgery, but his fluid electrolyte balance, nutritional status, everything should be at the optimum level. And whose responsibility to take informed consent, Sukhvinder Kaur? Can you tell me? Yeah. See, we make sure that consent is there, but informed consent. The doctor should inform all the complications, indications, contraindications, complications, everything should be explained and take informed consent. See, it is a work of the physician. Our responsibility is to check it, whether it is done or not. See, general post-operative care, we are going to study in detail. Number one is psychological support. Okay. And then number two is some client teaching is needed, like coughing, breathing exercises, and how to support the wound if the patient has some cough, leg exercises to prevent thrombophlebitis later. Then how to turn on bed, how to get out of bed, and about the use of analgesics, we have to teach them. When we have to give analgesics, by the way, Elizabeth, can you tell me when the patient has mild pain, patient is complaining of mild pain or patient has a severe pain, when we should give pain medication for the post-operative patient?
Patient has severe pain.
No, my dear. We have to give large dose, no? When the patient post-operatively, if the patient has mild pain, not mild means pain at the onset of the pain, that is the correct answer. At the onset of pain, we must give pain medication. This pre-operatively we must teach the patient. Okay, not that the patient will struggle the whole night and in the morning. No, we should. Then the large dose of pain medication is needed. That is the rationale behind it. So when a pain medication should be given at the onset of pain, that is a question. Okay. Then about the recovery room procedures, we have to teach them, otherwise patient will be very anxious, and in the post-operative room, recovery room, patient will be alone and we the nurses, doctors only will be there. Patient's relatives will not be there. All these things will increase their anxiety. So all these things you have to explain earlier. Then about the type of dressing that we do. Sometimes the patients will have many types of catheters, NGT tube, wounded drains will be there, and also urinary catheter. So what is expected post-operatively, this teaching should be done pre-operatively. Alright. Now, immediate, just before sending the patient to OT, you have to take vital signs and make sure that skin is prepared. We have to do the general cleaning. Then in the in the operation theater, they will do the cleaning for the surgery. Then oral hygiene, And if the patient's NBO goes to midnight in almost all the surgeries, because they will be having anesthesia. And also about sometimes enema is needed, that also should be done the day early morning, sometimes early morning, the day of the surgery. Okay, then what are the pre-medications that we will give? And what is the purpose of giving this pre-medication? Sukhvinder Kaur, can you tell me something? Why we should give pre-medication?
To reduce the pain.
Pain is coming only, no? To reduce anxiety, number 1.
Anxiety.
Number 2, to reduce the secretions during the surgery, to reduce the secretions. Okay, then if we give pre-medication, we can reduce the amount of general anesthesia. Okay, then another one is some patients will have nausea, vomiting, and to some extent we can control that. So these are the purposes of giving pre-medication. And common pre-operative medications, please write. Morphine sulfate, promethazine or Phenergan, atropine, phenobarbital sodium. It depends upon the mutual decision of the surgeon and the anesthetist. Okay. So the main purpose and at what time you should give all these things should be correctly carried out. Then types of anesthesia, there are general anesthesia and spinal anesthesia, and that also after discussing the complications and after effect of this anesthesia, proper explanation should be given to the patient, and also this is after discussion between an anesthetist and the surgeon. See, tell me, we studied that spinal cord injury when we studied. I said that we have a complication with the spinal anesthesia also. What can be? The nurse should monitor for that. What is that? Elizabeth, do you remember? Patient with the spinal cord injury, patients with the spinal anesthesia. What complications a nurse should be careful?
Shock.
Oh, super. Yes, spinal shock. That is the correct answer, Elizabeth. What you said is correct. Okay, then general post-operative care. We have given all the teaching. Now patient had his surgery. Now first thing is airway. Okay. Then patient's breath sounds should be checked. And day 1 onwards we have to teach them the importance of coughing and deep breathing exercise. And they should give proper support to the abdomen if the patient is coughing. And if the patient has any respiratory tract infection at all, it should be already treated before surgery. Okay. Then neurological assessment, patient's level of consciousness, reflexes we should check, and circulation, and all the tubes, all the catheters that the patient has, we have to check it. Then before giving anything orally, what reflex we should check, Nimisha? Gag reflex, you are correct. So that is very important, okay? Patient may ask for some tea, water or anything, but the nurse's responsibility is to check the gag reflex. These are the questions, okay? Then about if there is any abdominal distension, any bladder distension, these things should be carefully observed. Then what are the immediate nursing management is all these assessments done, then frequent vital signs, NBO until gag reflex is returned. Then if suction is needed, that should be done PRN. Then medication, according to the doctor's order, we have to give medication and turn the client, coughing, breathing exercises, monitor intake and output, fluids, and also if any complication of anesthesia, we have to check. Okay. See, where we will put the needle for spinal anesthesia. When we studied lumbar puncture, I had mentioned this. Where we will, spinal anesthesia we studied, where usually, where it will be, the needle injection will be given. Between?
On the L1, S2? between the subarachnoid space.
L3 to L5. Okay. Not in the sacrum. Lumbar vertebra. Lumbar area we will give. Okay. Then about spirometer. You all must have seen in your hospital because you are all working. Spirometer. You have to teach the patient how to use the spirometer. This is a breathing exercise. Okay. Now, what we will study is what are the common post-operative complications. I have sent you the notes. Please see atelectasis number 1. See, this complication usually occurs in the first 48 hours. If there is fever, if the increased pulse respiration, we should suspect for atelectasis. And the important problem will be, respiration. So, shallow respirations. Then patients can have pneumonia, hypoxia, nausea, and some patients will go to shock, urinary retention, wounded hemorrhage. All these are the common post-operative complications. So the nurses should be vigilant enough to observe all these things. Then you see, the commonly asked question is about atelectasis. I told you, first 48 hours post-operatively, chances of atelectasis and respiratory symptoms. Okay. 2 to 3 days after the patient has fever, most probably it will be UTI, urinary tract infection. Then later complications can be there. What are some other complications? Can be thrombophlebitis, wound infection. Thrombophlebitis, usually the fever will be there after in a week time. Okay, 7 days. In a week time, if the patient after a week, if there is fever, and if the patient's sites, if you will examine, there can be chances of thrombophlebitis. First 48 hours atelectasis, 2 to 3 days UTI, and after 1 week, usually it is due to thrombophlebitis. Then other conditions are wound infections can be there in 4 to 5 days usually. Wound infections can be there. Wound dehiscence. What is wound dehiscence? Wound dehiscence and wound evisceration. Can anybody tell? Elizabeth, wound dehiscence means? Just from your theoretical knowledge. What?
Sockage.
Block? No.
Sockage.
Sockage. No. Opening of that incision. Wound dehiscence. Wound evisceration is. Check my notes. Wound evisceration is. See, internal organs protruding through the abdomen. So these are the rare complications, but we must study that. Wound dehiscence means, there is the wound is opened. Maybe and the evisceration is the organs protruded through the abdomen. Alright, these are the complications we should check. And you see, all these complications usually in 15 days time. So first 15 days of post-operative period is crucial. We should check for all, especially fever. Number 1 is fever. Any redness, inflammation. Patient has breathing difficulty. Okay, so all these things you have to take care. Okay, so this is a short chapter, and just go through my notes, please. Okay.